Hi everyone, Dr. Alisa Kauffman here with Dr. Terry Grant from Suffolk County, and we are going to talk about a problem that I hear about often, which is my tooth fell out or the patient's tooth fell out. And our first response as a dentist is, did the whole tooth come out? Do you see the root, or did you just see the top of the tooth that came out? And usually the patient or the caregiver doesn't know. So we ask for pictures, and sure enough, there it is. The tooth is still in the root. The root is still in the bone, I should say. Mm-hmm. So what do you do about that? Do you naturally take out every tooth that's left?
No. I take a look, make sure I look if there's no there's no discomfort, there's no infection, there's no, we call it pathology. Sometimes you might want to just leave it alone.
Right.
As we age, the nerve supply in the tooth thins. And that's one of the reasons why an older person with a fractured tooth will have no symptoms, but a younger person with a fractured tooth will have a lot of symptoms, because as we age, the nerve thins out.
That's right. And so if you take your loved one to a traditional dentist that does not have the skill set that we do as geriatric dentists, they may have give you the diagnosis that the root needs to come out. And they don't want to do that. So they call us for a second opinion. And when we get there, we know that tooth can be left in 95, 96 frail. You don't want to do a surgery if there's
That's what I was going to say.
If there's no issues.
Subject the patient to harm for no reason.
I mean, if they're in pain, obviously we want to help them, and we will take it out, and that's not a problem. But we will leave in teeth that really can be left in, and that's up to us to decide. Mm-hmm. All right. Now, I want to talk about the reason why this happens. I mean, sometimes they are grinding their teeth.
The force they're placing on their teeth is just not strong enough for the teeth to withstand the forces.
So we say that they're grinding, that's the noise, and it's really a hard, like fingernails on the blackboard. Right. And I'll hear that quite often. So what's that do to all that grinding?
Well, what we want to do is we want to stop it. You have to keep in mind that the top teeth are attached to your skull. It's the bottom teeth that's coming up. So that muscle is pulling on those bottom teeth to force them into that grinding position. And the more forces they place on it, the more less likely, just a matter of time, something's going to eventually break.
Exactly. So do you make an appliance?
We can fabricate the first thing I do is I take 2 cotton rolls, place them in the patient's mouth, have the patient bite down, and ask them how they feel. Not the dementia patient, of course, but I'd ask them how they feel. And they'll look at me and go, "Whoa, that feels much better." Yes, because now we can fabricate you an anti-grinding appliance.
Right, anti-grinding, anti-chewing, whatever their habit is. It breaks them of the habit. So you will go in there, you'll take an impression.
Take an impression and send it to the lab, or I go into my office and fabricate the anti-grinding appliance myself.
Right.
The speed is important to me because I want to get it in the patient's mouth as fast as possible.
Exactly.
I don't want any more teeth broken off.
And we have to monitor these patients because I have seen some of them grind through it and try to even chew and eat and swallow it. So we're really going to be careful about that. So when we give it to you, we're going to give you instructions to watch them to make sure it does not get bitten through and then become a piece of food, because that's a horrible situation that we don't want to happen. Yeah. So we're going to break the habit of the grind, and that usually works.
It works basically it works all the time.
99, except for the one time I saw the guy chew through it. I know it was the first and only time, but something always has to happen.
Wow.
So we could come in, assess the situation, decide why the teeth are breaking, if it's decay, if it's grinding.
Right.
And we will be able to help your loved one heal.
Correct.
Give us a call. Give us a write. Look on our website, Geriatric House Call Dentistry, fill out the form, and we'll be happy to answer your questions.